about 1975, we're only 30 years away from that. So somebody that was treated for cancer and when they were 5 years old are now only 35. So I think we still have a lot to learn, and every day our knowledge about sort of what these long-term consequences are is changing. And so first of all, I'm going to talk about the rates of infertility among our cancer survivors. And unfortunately, it's actually quite difficult to determine fertility risks in our long-term cancer survivors, and there's many reasons for that I'm going to go through. The first one is kind of an obvious statement, but it actually has big implications when we start trying to study who's at risk of going on and being infertile. And that point is, if you never try to have a baby, you don't know whether or not you're infertile. And so it's very easy, if you have 100 cancer survivors and you say 70 of them had children and 30 of them didn't, is that because the therapy we gave them made 30 of them not able to have children? Or did those 30 people not want to have children? Did those 30 people try to have children and not do it correctly? Because quite honestly, it's not super easy to get pregnant. There's only about 4 or 5 days out of each month that a woman is actually fertile. So somebody might have been trying for years, but they were just trying on the wrong day. And so there's a lot of things that go into this that it's not black and white, and therefore we can't say what the statistics actually are. The other problem is there's really no definitive test to tell whether somebody's infertile. Short of actually surgically removing your testicles or your ovaries, we have no way of doing some sort of blood test or anything like that to say, yes, you are infertile, there's no way you're ever going to have children, and you are not infertile. And so a lot of it is just sort of guessing what the likelihood of somebody is going to have based upon information from other patients. The other problem is infertility is quite common in people that never have any history of cancer. And so this is actually data from the U.S., from the Centers of Disease Control.